Today, I would like to talk about the metabolome analysis of plasma using the kit in a large cohort study in Japan and its application to cancer biomarker discovery. Although there are various methods to analyze human phenotypes, such as genome, transcriptome, and proteome, metabolome is the most downstream of the central dogma and is considered to best reflect human phenotypes. Therefore, metabolome analysis is considered to be useful in searching for biomarkers for disease prevention and diagnosis. The map of metabolic pathway of the organism is shown here. There are numerous metabolites in the human body, and their properties are very diverse, ranging from hydrophilic to hydrophobic. Especially in our large-scale cohort study, it is necessary to measure a large number of metabolites with high throughput and accuracy. Tohoku University, Tohoku Medical Megabank Organization, TOMO, was founded to establish an advanced medical system to foster the reconstruction from the Great East Japan earthquake. The organization has been developing a biobank that combines medical and genome information during the process of rebuilding the community medical system and supporting health and welfare in the Tohoku area. The Advanced Research Center for Innovations in Next Generation Medicine, INGEM, was established in 2017 as the hub of the next generation medicine to bring together the university's preeminent research capabilities in fields such as information science, basic life science, and genomic medicine as the core subject. INGEM has established a clinical biobank where biological samples of patients with various diseases, mainly from Tohoku University Hospital, stored, and we are conducting omics analysis of these patient-derived samples. Previous metabolome analysis in TOMO using mass spectrometry is shown in this slide. We used to platform metabolic analysis using global metabolomics and GCMS. But since these results are relative values, it is very difficult to compare batch to batch and between facilities. However, recently Biocrates has developed a targeted metabolomics kit, and we have used it to platform metabolomic analysis on a number of plasma samples. The features of the absolute IDQ P180 kit and the MXP Quant 500 kit are shown. These kits are very useful for our large cohort studies because they can quantify a large number of metabolites in a very high throughput manner. Furthermore, the amount of sample used is very small and normalization between batches is easy. And this slide shows the analysis flow in TOMO and INGEM. We are using commercially available plasma as our own global quality control ZQC. And we applying ZQC to 4 wells per plate. We have performed many plate-to-plate normalizations using the quantitative values of this ZQC sample and have obtained very stable results. We have measured more than 10,000 plasma samples from the TOMO cohort sample and more than 1,000 plasma samples from the INGEM clinical biobank for cancer. diabetes, and cardiovascular disease. Other samples such as serum, urine, bile acid, feces, and exosomes have also been measured. NIST is an internationally used human reference plasma, and many quantitative values of metabolites measured by various methods have been reported. We used this reference plasma to check the accuracy of the MXP Quant 500 kit. This data compares the quantitative values of representative metabolites using the MXP Quant 500 kit with those measured by NMR. The graph on the right shows the ratios of the respective quantitative values, and most of the metabolites have well-correlated quantitative values, while the 6 metabolites shown in orange have more than twofold differences, indicating differences depending on the quantification method. We have published the quantitative value of metabolites in plasma samples of the Tomo cohort obtained using the kit in the this Japanese multi-omics reference panel, JMOP, shown here. This database can be accessed via the internet to obtain metabolite information, as well as genome, methylome, transcriptome, proteome, metagenome, and pharmacogenomics information. The database of metabolites looks like this slide. You can see a histogram like this by clicking on the ID and the name of each metabolite. Some of metabolites change in relation to age, gender, and BMI. In addition, the quantitative values of mixed plasma and ZQC measured by us are also published in this database. So these quantitative values can be used. Here is a graph that visualizes the quantitative values of the Tomo cohort samples. The left panel shows the differences by gender, and the right shows the differences in metabolite profiles for each individual. In the graph on the left, the blue line represented males, the red line represents females, and the black line represents the median. The graph clearly shows that triglycerides are higher in male, while spring lipids are higher in female. We call this graph the metabolic index. So metabolic index can be utilized for creating the personal health care program and searching the predictive biomarkers. Also, in this graph, male on the left and female on the right, with darker colored lines indicating older people and lighter colored lines indicating younger people. Especially among female, older people have higher TZ than younger people. Also, in this graph, male on the left and female on the right, with darker colored lines indicating higher BMI, and lighter colored lines indicating lower BMI people. In both cases, TG was found to be higher in those with higher BMI, while PC, including polyunsaturated fatty acid, was higher in those with lower BMI. As described above, metabolites that differ by gender age, and BMI have been identified in the sample population of our large cohort, and more detailed analysis is expected. So in the next section, I will talk about the results of comparing metabolite profiles for TOMO cohort samples and cancer samples in the INGEM clinical biobank. Cancer has been the leading cause of death in Japan in recent years, with 9.6 million people deaths worldwide in 2018. The number of cancer patients is increasing every year, and it's a very important disease worldwide. Cancer cells are known to reprogram their intracellular metabolism, and in general, the Warburg effect causes the glycolytic system to become dominant. It has been reported that variety of characteristic metabolic pathway changes and metabolite fluctuations occur accordingly. Therefore, metabolome analysis is very useful for identifying biomarker for diagnosis and prevention of cancer. Initially, we analyzed several types of cancer samples using the P180 kit and compared their metabolic profiles with those of the cohort samples. This slide shows the results of PCA and S-plot. The analysis showed that there are differences in metabolite profiles between cancer and cohort samples. Especially tryptophan, histidine, leucine, and valine were decreased, while glutamine was increased in cancer patients. There was also a decrease in LPCs, suggesting an increase in LPA production associated with the inflammatory response. This slide shows the metabolites with particularly significant differences. Histidine, valine, and LPCs show large changes. Furthermore, an increase in kynurenine was observed, while tryptophan and serotonin were decreased. They are involved in the indole metabolic pathway, suggesting that activation of the kynurenine pathway is involved in cancer progression. In addition, the decrease in LPCs was attributed to the renewal of degradation of autotaxin and the increase in lysophosphatidyl acid. Next, this is the result of comparing the metabolic profiles of 7 ovarian cancer patients before and after cancer chemotherapy. All the patients are receiving TC therapy. The red line is mean value of the cohort samples. Patients numbered 1 to 6 have a good prognosis with metabolite levels recovering to the same levels as healthy individuals after treatment with chemotherapy. While patient number 7 has a different cancer subtype and a worse prognosis, it was found that metabolite levels were negatively correlated with other patients. We have also measured metabolites by GCMS on the same cancer patients' plasma samples. The results of OPLSDA and S-plot are shown here. OPLSDA showed a significant separation of the two groups. We defined significant metabolites as those with a VIP score of 1 or higher, and a correlation coefficient of plus minus 0.2. Here are the metabolites that were significantly altered in the cancer samples compared to the cohort samples. The results showed that 11 metabolites were significantly elevated. In particular, quinolinic acid is a metabolite located downstream of the quinorenin pathway, and these results support activation of the quinorenin pathway. On the other hand, the results showed that 21 metabolites were significantly decreased. Significant reductions were observed in many metabolites, including tryptophan. The metabolites included in amino acid, tryptophan, fatty acid, pentose phosphate pathway, and ascorbate and aldolase metabolism. 11 compounds were significantly increased in cancer, and 21 compounds were significantly decreased in cancer. As a result, GCMS metabolome analysis supported the results of the kit-based analysis. Next, we compared gastric cancer with cohort samples using the analysis data from the MXP Quant 500 kit. 308 samples from the cohort and 77 samples from gastric cancer were used for analysis. PCA showed a slight separation, while OPLS-DA showed a significant separation. Therefore, significant metabolites were selected from S-plot. Tryptophan, histidine, lysine, leucine, valine, LPC, and some PC were decreased, while alanine, glycine, chlorine, cysteine, cholesterol esters, and TGs increased in gastric cancer patients. In addition, there is a marked increase in bile acid and marked decrease in free fatty acid. There are reports that bile acid-related metabolites are involved in the formation process of gastric cancer. Furthermore, there was a significant decrease in tryptophan and a significant increase in quinorenin, similar to previous results. This may indicate the importance of indole metabolism in cancer progression. Now, we then compared ovarian cancer samples with those of the cohort. A target metabolome analysis was performed on 80 ovarian cancer patients and compared metabolome profile with 80 TOMO cohort samples that matched age, height, weight, and BMI. PCA results showed slight separation of the metabolomic profiles of ovarian cancer patients and TOMO cohorts, whereas OPLS-DA results showed strong separation, suggesting characteristic metabolome profiles for each group. Compared with the TOMO cohort, 77 metabolites were significantly increased and 114 metabolites were significantly decreased in ovarian cancer patients. Here is a heat map of metabolites that showed significantly changed. As in previous results, there is a significant decrease in histidine, serotonin, and PC, and a significant increase in TGs. In particular, the decrease in PCs containing unsaturated fatty acids was found to be significant in ovarian cancer. The results so far suggest that the kynurenine pathway plays an important role in cancer progression. Therefore, we confirmed the relationship between the ratio of kynurenine to tryptophan and the prognosis of these ovarian cancer patients. When the kynurenine tryptophan ratio was compared between the CR, PR, and SD/PD groups for efficacy of first-time chemotherapy, there was a trend toward higher ratios in the SD/PDs, but no significant difference was observed. However, when compared by patient prognosis, the worse the patient's prognosis, the significantly higher the ratio of kynurenine and tryptophan. The kynurenine pathway is enhanced in ovarian cancer patients with high endoramin 2,3 dioxygenase, ideal activity, and may be involved in the deterioration of ovarian cancer by suppressing tumor immunity. Kynurenine tryptophan ratio can be used as a biomarker to predict the prognosis of ovarian cancer patients. Plasma metabolome analysis is useful not only for the diagnosis of ovarian cancer, but also for predicting prognosis and evaluating a response to chemotherapy. This slide shows the mechanism of kynurenine and cancer progression. The kynurenine
Professor Hishinuma, we're already 2 minutes beyond time, so we please must come to your final slide.
Kynurenine to tryptophan ratio reflects ideal activity, and the higher this ratio, the more kynurenine production is enhanced. Kynurenine acts AHR, regards the transcription of various genes and inhibits T cell function, resulting in the suppression of the immune system. So finally, we present a comparison of cervical cancer and cohort samples that we analyzed in the same method. Some specimens are collected on the time course related to radiation treatment. PCA didn't show good separation, but OPLSDA showed a significant separation of the two groups. A heat map of metabolites that showed significant changes in shown as well. This may have an effect on cervical cancer growth and survival. The decrease in PCs also confirms this result, while decrease in histidine and tryptophan and increase in CE, TZ, and cysteine metabolites are similar to other cancers. Moreover, decreased levels of ornithine and beta-alanine and increased levels of carnitine and ceramide, which are characteristic of cervical cancer. Finally, the effects of radiation were compared. As a result, PC, methionine sulfone, proline hydroxide, cysteine, asparagine, and TZ decreased during radiotherapy and increased after radiotherapy. In contrast, carnitine decreased after radiotherapy. This suggests an effect of radiation exposure. In addition, there are significant differences in some of the SM, hexosylceramide, CE, bile acids, and highly unsaturated fatty acids when compared with the therapeutic effects of radiation in PD group. These metabolites may affect the sensitivity to radiotherapy in cervical cancer. So in conclusion, we showed that the usefulness of metabolome analysis using the kit in large cohort studies and its application to biomarker discovery. Moreover, the metabolome analysis of patient plasma may not only serve as a marker for cancer, but also be applied to determine treatment effects and predict prognosis. We will measure and validate more samples in the future. we also expect to measure other methods such as nucleic acid metabolism and proteome to identify more reliable biomarkers. Thank you very much for your attention.